You might remember that last semester in Practice 1, we talked about the early history of orientation and mobility. And we went through the early development all the way up through the development of university programs. What I would like to do now is take you from the development of university programs through our current status and talk about what's evolved along the way, and then talk about some position papers and how they affect the services that we provide. So let me begin. And I'm going to start with the university programs. You might remember that the Office of Vocational Rehabilitation began sponsoring programs right at the turn of the decade in 1960. And the first program that was developed was Boston College. And Boston College developed a master's degree program. It was decided at that point in time that the university programs would be at the master's degree level. And I think the reason for that was because there was such a screaming need for orientation and mobility specialists. And if it were to be at the undergraduate level, it would have taken 4 years to develop. Whereas at the master's level, it could be a year, year and a half to 2 years. So the first program at Boston College was called parapetology. And that basically means the study of moving around. And so the first graduates of that program were called parapetologists. And that program continued on for a long while, but eventually closed, and the term parapetology fell out of favor, and instead, a term that was developed at Western Michigan University, orientation and mobility specialist, became the term that was used. Now in 1961, Western Michigan University had its program funded, and it was a program that was a year or so in length, very concentrated, and it was at the master's degree level. Those two programs functioned for a long period of time, and Western Michigan University is still one of the premier programs in the country, with probably the largest faculty and the best resources. It wasn't, however, until 1966 that programs were sponsored by the Office of Education to prepare instructors who would teach children. Because up until that point in time, it was primarily preparing individuals who would teach adults. And 1966 saw the development of the San Francisco State program. And it was understood that the success that the programs had in teaching adults could easily be really modified and expanded upon so that children could also be prepared. The next great change occurred with the development of undergraduate programs, and this began also in 1966 with Florida State University. Following that, Cleveland State University began its program in 1972. I joined that faculty a little bit later and became a faculty member in that program. Also in 1972, Stephen F. Austin University developed a program, an undergraduate program. Today, there are almost 20 university programs that are offering orientation and mobility. Most of them are at the graduate level. A good number of them have certificate programs that are add-ons for individuals who already have a bachelor's degree or a master's degree in a related field. Every profession begins by having a professional association, practitioners that come together, that share mutual interests and can share information. In 1965, the organization, the American Association of Workers for the Blind, formed an interest group, and it was called Interest Group Number 9. That has evolved through AER, which is the successor organization from AAWB. And the name was changed from Interest Group 9 to the Orientation and Mobility Division. In the meantime, there were state structures that evolved, and in a number of different states, orientation and mobility divisions were established. New York was one of the early ones, Pennsylvania was another, and there were others that developed a state structure for divisions of orientation and mobility. Beyond that evolved a regional structure, and the regional structure was not necessarily associated with AER, but developed independently. NACOMA, COMA, NOMA, SOMA, SWOMA, they're all orientation and mobility associations. North Central, Central, Northeast, South, Southwest, and every year they come together, and they're made up of different states, and typically they will hold a conference and share information about the field. Let's move on to talk about standards of service. In the 1960s, an organization called ComStack was put together to develop accreditation standards for agencies and schools serving visually impaired adults and children. And it formed an organization called the National Accreditation Council. And as ComStack was developing its standards, it made note that it would be necessary to develop standards in orientation and mobility. And so with that as a spark, in 1967 through 1969, AAWB, the American Association of Workers for the Blind, began looking into developing certification standards and developed its own set of standards. Eventually those standards became standards for AER, the Association for the Education and Rehabilitation of the Blind and Visually Impaired. In 1973, it was determined that a code of ethics was also necessary for the growing profession of orientation and mobility. I had the privilege at that time of chairing the Code of Ethics Committee and working with Richard Welsh. And together we sent out questionnaires to all practitioners of orientation and mobility in the field. And we asked them what were the issues that were troubling them, what were the issues that really needed clarification. And they sent back questionnaires, and from that we developed the first Code of Ethics. That Code of Ethics was accepted by the profession, by AAWB at that time, and then AER, but was transferred to the new certification body, ACVREP, which we'll talk about shortly. Let's move on. And we'll talk about university preparation and the university program approval process. With the development of these university programs, there was a need to develop an approval process for those universities that met the standards of the field. And so between 1977 and 1979, a process evolved, and several of us were involved in writing the standards for that process. There were revisions to that process in 1988 and in 2000. And in the early years, we would go to the various universities and we would spend several days looking at their programs. And if they met the standards, they would be approved by our professional organization. However, after a while, that became very expensive, and the process seemed to go into a hiatus. Nevertheless, during those years, we looked at the administrative requirements, the qualifications of faculty, the entrance requirements for the programs, the retention requirements for students and statistics of those retention requirements, clinical requirements relating to the practice components, and the various curricula. But as I've mentioned, that did go into a hiatus. And instead, what developed in 2006 was an interdivisional process. So rather than having each division, which had been done in the past, review its programs individually, a joint program was put into place. And it was coordinated through the AER board. So the various divisions, orientation mobility, vision rehabilitation therapy, and the other divisions that had professional programs came together and had a joint review process put into place. The divisions set their own standards for the review of the university programs, but it was done jointly. And today we have a pool of 30 reviewers for O&M, VRT, and TVI. And we are working on developing standards for low vision therapy as well. When a university is reviewed, it's now done not by going to the university, but by doing it electronically. The university submit a self-study guide. I'm currently chairing the review process, chair of that process, which I've done for the past 7 years or so. And what we will do, and what we do each time, is we select a panel of 4 reviewers. 3 of them come from the specialization and 1 comes from another division that's related. And we hold an electronic review and we hold teleconference meetings. We talk with the faculty and we talk with the students in the program. And AER oversees that process. It's about $1,750 to review 1 program, and then the cost is reduced slightly for a 2nd and 3rd program. Let's also talk about the evolution of certification. And as I've mentioned, certification began with the American Association of Workers for the Blind, 1964 and 1965. And we talked about the fact that ComStack called for a certification body, and it was in 1969 that that certification was actually established through AAWB. The standards were revised in 71, 77, 94, and 95, and more recently in 2014 and 2015. The early standards required that a person had 20/20 vision with no visual field defects. And that caused quite a stir and caused a real dilemma, with 2 sides really fighting each other for quite a while. It really became quite a tug of war. The professionals wanted to assure the safety and of the consumer, but the consumers wanted equality. They wanted also blind consumers to have a role in teaching orientation and mobility. So both sides had the right reasons, but that tug of war had negative consequences for both sides. And let's talk about a conference on alternative approaches that developed. The Orientation and Mobility Division sponsored a conference that took place at the AFB Leadership Conference. And we brought in instructors who were blind, who were not certified, and who had primarily been trained by the National Federation of the Blind. And we examined how they performed, how they managed their own training of individuals who travel, doing it without having any sight. And that resulted in opening certification to blind instructors. This was back in 1994. This is a picture of how blind instructors actually do train other people who are visually impaired. And we studied how that occurred and opened up certification at that point in time. And now blind instructors are certified. It used to be that certification didn't have an exam per se, but it was based upon someone graduating from a program that was acceptable. So along the way, we developed a certification examination. And it was a drive towards equality with other professions that required certification examinations. We held test writing seminars. We hired a national consultant from CORE, the Council of Rehabilitation Education, to help us develop our examination, or at least the methods for the examination. And eventually we came up with an exam, and then we decided that we wanted it to be independent from AER. And so the AER Board of Directors in 1997 recommended that a committee be established to develop a plan to create an independent organization to do the certification. And so the certification separated from AER in 2000. And it was then called the Association for Certification of Vision and Rehabilitation Professionals, or ACVREP. And at one point it was 2,000. It's much higher than that today, of those who are certified. Certification is going in new directions. Certification outside of the United States and Canada doesn't really exist at this point. Most of the training that has occurred has happened at dog guide schools in those other countries, although some universities do exist in some countries. Most of it has been agency training or dog guide training taking place at dog guide schools, guide dog schools. So we're right now currently considering how can we expand certification, how can we grow the profession and grow the quality of the instruction. And so what we're considering right now, and I am co-chairing one of the committees that is looking into this. We're looking at how we might certify practitioners who come from other backgrounds in other countries where university education is not as prominent. So in those other countries where they do have university education, we're going to still use the same model of a bachelor's or a master's degree in orientation and mobility, or a certificate that's added on that is university preparation. However, those that have less preparation from countries that don't have that same university model, we are looking at certifying them with a different designation. Most likely it'll be COMS, COMS, but it will be not the universal, but it'll be specific for their country. So that is what I think we will see in the near future. Now, I also need to mention that there is an alternative certification that was developed and does exist alongside of ACVREP. In spite of the fact that the O&M division in 1994 opened up certification to individuals who are blind and visually impaired, in 1997 the federal government sponsored an experimental and innovative grant from the Rehabilitation Services Administration, and the purpose was the recruitment of blind individuals into a university program specifically for blind individuals. And that E&I grant eventually led to the establishment of the National Orientation Mobility Certification Program, or NOMC. And that training is different from what we currently have in our university programs. And in 2001, a separate body, the National Blindness Professional Certification Board, NBPCB, was created to administer the NOMC certification. And it has different standards from the ACVREP standards. The certification standards are not at the same level. It requires a high school diploma or equivalent, completion of 480 hours of prerequisite immersion training and at an NBPCB approved center. Provision of 800 hours of supervised instruction within the last 5 years or training at a university program that is NBPCB board approved. At the time that this was put together, there were probably 60 to 80 people who've gone through that program. It is basically for individuals, by and large, who've gone through National Federation of the Blind training, who don't have university preparation, although there are university preparation graduates from that program that was first established who also hold this certification. So what's the current status of ACV REP certification? It's a large organization. It has a subject matter expert committee, which has 14 members. I am recently have left that committee, but still co-chair one of its committees, one of its membership committees. That committee is working on a revision of its test items. It's always working on updating its exam. And I am co-chairing the committee right now that is working on the clinical hours of instruction. And right now the clinical hours of instruction require 350 hours and really do not state the number of hours of direct practice that have to be included. And we're working to specify what those numbers need to be. So let me bring you up to date on our position papers. This is a very important part of AER. Many of our practices come from the writing of position papers. They're written by members and they're approved by the division itself. So there is a professional issues committee. It was first established in 1986 to develop papers. It explains, it justifies, it recommends a particular course of action. There are 6 different position papers that have been developed. Some are very active, some have been put to bed, so to speak. The first one was one on orientation and mobility assistance. It was developed in 1988. It was developed with funding that came to myself and Everett Hill from the federal government. We trained 130 supervisors who were to train orientation and mobility assistants to work with fully trained orientation and mobility instructors. However, only 13 assistants were actually trained, and so that program was kind of laid to rest. A second position paper was support of university preparation programs. It was based on a resolution that reaffirmed that AER supports university preparation and certification standards. In 1990, the paper stated that visually impaired individuals deserve the state-of-the-art O&M services as they're taught in university preparation programs. Paper number 3 was the role and responsibility of the O&M specialist. Developed in 1999, the paper outlines the roles and responsibilities of the specialists and lists the essential responsibilities that are unique to the O&M profession itself. It summarizes the academic and clinical competencies. Paper number 4, which I had the pleasure of being able to co-author, in 2004, was a response to O&M specialists who are required by their employers to use visual occlusion for every single individual as part of their O&M instruction. The paper states that the consumer, along with the instructor, make the decision as to whether or not to use visual occlusion as part of the instruction. It is not a decision that the instructor should make independently, but needs to be made with the consumer based upon the visual needs of that person and how quickly or not their vision might deteriorate. Number 5 was a paper on the instruction on street crossings at signalized intersections. Because we have so many computer-controlled traffic signals, it became necessary to really take a stand on this. And the paper basically says that there are many new techniques for travel based upon this new technology, and that instructors really need to be up to date on signalized intersections. The next paper had to do with teaching through individual and group lessons. Again, I had a hand in writing this one as well. O&M instruction has typically been one instructor to one student, and never one instructor to more than one student at a time. However, in this paper, we outlined a plan for group lessons that may be an option as appropriate and when they're advantageous for the student. By and large, it's never with active travel instruction. It could be for supplementary activities. For example, group discussions, or for, let us say, scavenger hunts, something that may be motivational in nature, but not really not direct lessons. All direct lessons still need to be one-on-one instruction. So we have some critical issues that I want to mention. Code of ethics versions. We very often find that the new technology makes it necessary for us to update our code of ethics. The code of ethics is now controlled by ACVREP. We are also now working on a code of ethics through AER for those divisions that do not have professional ethics, codes of ethics. And I believe at the next AER conference we will probably have approval of that a new code of ethics for those divisions. Medicare reimbursement is another issue that is looming large. We find that we don't have third-party reimbursement in most states. There are very few where it is workable. We find that other professions, such as OT or PT, can be reimbursed, but since orientation and mobility does not function under the medical model, and we function without supervision of a physician, we do not have Medicare reimbursement. We have a committee right now that's working to see how we might be able to move more into third-party reimbursement. Another important issue is quiet cars, electric cars, hybrid cars. We've conducted a number of studies over the years that show that they are much quieter than cars that have internal combustion engines. And so we've worked with the manufacturers to make sure that they are at least loud enough so that blind pedestrians are able to hear them, although they are certainly quieter. Another critical issue is roundabouts. We've seen the development of roundabouts rather than the typical plus intersections, and they're much more difficult for a visually impaired person to really navigate. And so we've been doing a number of studies on roundabouts to determine what are the best ways of being able to cross them. I think in the future we're going to see much more on visual prostheses. We have now visual prostheses that can be connected directly to the brain, that can give some form of vision. We've had several practitioners who have worked to try to train people who have had this type of surgery. It does provide a very primitive form of vision, but at this point in time not acute enough to allow people to really travel independently, but it does certainly help with their orientation. And of course we're always concerned about having enough literature. The area that I want to say just a little bit more about, there are a couple of areas. One is the Code of Ethics. The code that is being written for the divisions that don't have a Code of Ethics have these various areas that will be included: competence and accountability, advocacy, accessibility, relationship with consumers, relationship with other professionals, privacy and confidentiality, communication, advertising and other public statements, assessment, professional and business practices, university-based education and training, research and publication, administration, and resolving ethical issues. This new Code of Ethics will not be in conflict with the O&M Code of Ethics, but will be really a supplement. I want to mention that there was a Medicare reimbursement demonstration project that started in 2006. The idea behind it was to see if our instructors could be reimbursed for the services that they provided. It took place in 6 catchment areas, in Georgia and Kansas, 5 bureaus of New York City. North Carolina was a part of it, New Hampshire and Washington State. Number of catchment areas was expanded in 2007, but not enough data came through for this to be successful. And so we are still working on trying to develop reimbursement for Medicare. A final issue that I want to talk about is liability in the schools. We find that in some schools, the administration is very concerned about orientation and mobility instructors transporting students independently. They're concerned because of liability should there be an automobile accident that the school would be liable. So in some schools they insist that a school bus be used and that a driver drive both the instructor and the student. Not a very practical approach. In other schools they are making use of Uber to transport students. But in many schools, they've overcome this difficulty, and orientation and mobility specialists are able to use their own cars. If you should find yourself in this situation, you really need to check with the school system and with your provider of insurance to make sure that you are covered. So that brings us up to date with many of the issues and with the history. And certainly over the years, there will be many more issues that we will be seeing coming to the forefront.